Doctors A, B, C, D. Danger, response, shout for help, airway, breathing. CPR, which includes call 999 and chest compressions. And then D for defib. If it's safe and the danger is manageable, okay, they might have a dog tied to the waist, these amazing runners that take their dogs off, but that lovely pet dog potentially is not going to like you going near their human, okay? So if somebody else can help, that danger can be managed, then you approach. Then we look for a response, okay? Braden, can you hear me? Can you open your eyes for me? So Braden's either really deeply asleep, or he's ignoring me, or he's deaf. Could be any of the thing, could be anything, the what ifs and the who's and the whys. So at this point, I need to get down close. Now on a good day, I can get up and down off the floor happily. On a bad day, it might take me a minute to get back up again. But if you know you can't get yourself back up off the floor if you end up on your hands and knees, don't go down in the first place, okay? Get somebody who's fitter, who's still got a bit of suppleness left, in them, and tell them what to do, okay? That isn't a problem. You can still tell them. They're not going to get sued. You're not going to get sued for telling them the wrong thing, because you are trying to do the best for this person. So you get yourself down on your hands and knees. Okay, long way down some days. Okay, and we're going to shout and shake effectively. Braden, open your eyes for me. Now my voice is over his nose to try and cover both ears in case there's a hearing loss. I'm giving him quite a firm wallop, but not enough. I'm not shaking him, so I'm not going to cause any further spinal issues. I'm applying a very firm pressure. So he's not alert. He's not like me having a conversation with you. He's not responding to my voice. Open your eyes, okay? He's not responding to my pressure, so he's unresponsive. The first thing the ambulance will ask is your patient conscious, and then are they breathing? If they are unresponsive like this, they are unconscious, okay? So the first question answered, no, they're unconscious. I've tried this, nothing. So I'm then going to shout for help to get other people to me. It might be there's a defib close, we don't know if we need it, but actually let's get it, let's cover all bases fast as we can do, okay? But getting somebody to you means you've got extra support to do whatever else you might need to do. Then I need to check the airway, okay? So I'm going to look inside the mouth. I'm not aware that he's had a choking episode, okay? But if at this point, this person you'd witnessed a choking episode, it's a totally different thing, but they've gone down because they've stopped breathing, your chest compressions will work almost like the Heimlich, okay? So you can keep pressing the chest and hopefully it will come out, all right? But we're going to look to see mainly if there's any fluid in there, all right? What we don't want is fluid stuck within the airway system, because as I do my chest compressions, first of all, it's going to come and get in the face. Okay, it's going to make a mess, but we can't get any air down. Okay, so when I do a chest compression and I push down a third of the depth of the chest, I'm compressing rib against rib and squashing the heart, but also the diaphragm. I'm moving the diaphragm and it moves the lungs, which means just like an old-fashioned foot pump or a yoga pump, okay, when you push down, blows out, but when you release, sucks back in. So you're actually creating a vacuum. It will suck back in, which is why we don't need to do rescue breaths, okay? So look, no, nothing, or oh, there's fluid, send it that way. It's amazing how strong you can come. Grab a hip, grab a shoulder, let that drain away, okay? Bring them back. Then we're going to open an airway. So head tilt, chin lift, pop it back. Braden will snap back because he's a mannequin. Human would stay back. What we're doing is we are moving that tongue out of the way. This person may gasp. Happy days. Happy days. They were unconscious. They weren't breathing. Now they are. They still need an ambulance. We don't know why they were down in the first place. Okay, and it's more likely with small people, you'll have a respiratory arrest where their breathing has stopped, so their respiration has stopped, okay, than with an older teen upwards where it's likely to be a cardiac problem, okay. So I've not got a magic gasp. I'm going to check their breathing. So I'm going to come in nice and low. I've got my cheek near their mouth, my ear near their nose, and I'm looking down at their chest. Now what I would like, no more than 10 seconds, is for this chest to rise, fall, rise, fall twice. 2 I'd be happy with in 10 seconds. If I double it up and double it up, I get 12 in a minute, okay? So it's not brill, but that's okay, that'll do. You know, average person sits between 12 and 15, it'll do, okay? If it was 6, then it definitely won't do, okay? If you are unsure when you're down here, wasn't it? Did it? Give yourself 10 seconds. If you're not sure, it didn't, okay? We count it as it didn't. So we do hands only CPR, so we haven't got to worry about kissing a stranger. Okay, we do hands in the centre of the chest, so if you've done first aid many moons back, there's no more poking, working, it's all gone. No worrying about feeling for a pulse. It's been made very, very simple by the Resuscitation Council. Anybody can give it a go. Okay, if I'm on my own, I will do a minute of chest compressions if I've got to go get a phone. If I've got my phone or I've got other people with me, and what I do is I start my cycle of 2 minutes of chest compressions, okay? Hand over hand, doesn't matter, whatever you're comfy with. I like my person this way, I don't like the head at that way, doesn't matter, okay? That's just me. All right, and I like my right hand underneath, my left hand over top. Centre of the chest, it's harder on the table, you tip your toes, but you're going to press down 100 to 120 to a second. And we would do this for 2 minutes. Okay, so you'll see, side of his head, look, the blood's running up. His little brain's lighting up, so we like raising. Okay, third of the depth of the chest. It's about 5 centimetres on an adult. And we'll do that for 2 minutes. Okay, this is before my defibs come. To 2 minutes, I'm going to check for signs of life. Quick look in the mouth in case any foot more sick or anything has come up. Head tilt, chin lift. Magic gasp, no, unfortunately. No more than 10 seconds. Look, listen and feel. Still no breathing. 2 minutes more of chest compressions. And we just keep repeating that until the defib comes, the ambulance comes. So this is our AED prep kit. You get one with every defibrillator. You have the gloves, obviously to keep yourself safe. You have the tough cuts, shears, whatever you want to call them, obviously for removing the patient's clothing. They will go through underwiring of a bra so that you can get right down to that bare chest. We have the razor in there. Obviously, if there's a person with a hairy chest, you are going to need to remove the hair. This will give you a good 2 to 3 swipes on that chest so that you can get that pad nice and firmly attached to bare skin. There is the paper towelette, so you can wipe away the area should you have to have shaved it, or if the person is damp, then you can use that to dry that area before the pads go on. There are a couple of cleansing wipes, so should the person be really hot and sticky, you can give it a wipe off and then dry it afterwards. Equally, you can use those on your own hands should you need to. Then you've got the face shield, so should you have to do CPR and offer rescue breaths, that is there to help you stay safe. Finally, we have the little biohazard bag whereby all of the bits and pieces you've used can go into there safely and then be disposed of through incineration. We have our person, okay? Danger response, shout for help, airway, breathing, call 999, chest compressions, defib arrives, get all my gadgets out, okay, I've got everything ready, quite simply, press the button, turn you on.
Training scenario.
It's as hard as it is.
5. Adult patient. Call for medical assistance.
Making sure you've called. Yes, we've definitely called.
Remove clothing from patient's chest to expose bare skin.
Got to find the bare skin. Okay, he's
Pull green tab to remove pads.
Okay, green tab's in the bottom.
Apply pads to patient's bare chest as shown in picture. Press pads firmly to patient's bare skin.
He will repeat in a second. Pads show you where they need to go.
Pull green
Top
tab
right.
to remove pads.
Avoiding the nipple, especially if they've got a piercing.
Peel pads from liner.
Lower left.
Apply pads to patient's bare chest, as shown in picture. Press
It's like a
pads
driver's
firmly to
seat
patient's
belt.
bare skin.
If you forget which way you're going. Okay, so if you're driving, driver's seat belt. Top
Pull
right.
green tab to remove
Okay, around the
pads.
side on the left. Once it knows these are stuck,
Peel pads from liner.
it will assess.
Assessing heart rhythm. Do not touch the patient. Analyzing. Do not touch the patient.
It will do this in less than 10 seconds. It just seems like forever.
Analyzing. Do not touch the patient. No shock advised.
Okay, so it's going to talk me through CPR if I wasn't sure.
Begin CPR.
I can make a start.
It is
but I won't
safe
make
to
it
touch the
quick
patient.
so you can hear.
Place overlapping hands in middle of chest. Press directly down on the chest in time with metronome.
It's going to be.
Remain calm. Good compressions.
Okay. Different in the force that I really need. You'll see his little head lighting on up. And we're going to do that for 2 minutes until he says, okay, stop, check the signs of life, airway,
Good
breathe
compressions.
in. Then he'll analyse again. So rather than do 2 minutes, because this is where I lose time,
Assessing
he
heart
will
rhythm.
assess. So I've done my
Do
quick
not
checks.
touch the patient.
He's going to say, right, 2 minutes, perfect, get off.
Analyzing. Do not touch the patient.
He's going to offer a shock this time.
Stand clear of patient. Shock advised.
Okay, so this
Stand
one has
clear
a
of
button that I
patient.
need to press.
Press the orange shock button now.
Now it's not like on the movies, okay? He's not going to
Press
levitate.
the orange shock
And
button
he's going
now.
to keep cursing until I do.
Shock delivered.
And he's
Begin
going to
CPR.
carry on again, giving me the whole feedback.
It is safe to touch
The
the
most
patient.
you will see, like when you
Place
drop off,
overlapping
start
hands
falling
in
asleep
middle
in
of
an
chest.
office meeting. Okay, you start to drop.
Press directly
Ooh,
down
sorry,
on the
no.
chest in
I'm back
time
in
with
the room.
metronome.
That's it. That's about as much as you will see.
Remain calm.
Okay. He's going to do
Good
this
compressions.
for 90 odd minutes. Okay. I'm hoping my ambulance is here before then, because I am going to be on my knees.
Good compressions.
3 reasons that you would stop, and indeed you can then turn him off. They show signs of life, they cough, splutter, come back. Happy days. Shh, turn him off. If he goes again and stops breathing, turn him back on again. Off you go again. You can turn it on and off and on and off happily, not a problem whatsoever. Okay. Second reason I'd stop doing chest compressions, somebody more medically qualified comes, the paramedics are like, yeah, I'll take over for you now, move out the way, here you go, carry on. Okay, it's hard, it's tiring, not a problem, let them carry on. If they're happy when they come in, oh yeah, you've got that, fantastic, you're all right for a bit longer, they will put other things on that person just to try and get a set of observations. Okay, but otherwise, let them take over, happy days. The third and final reason is the hardest, especially if it's somebody that you know you love, all right? If this person, I've still got his chest open because it's brazen, if it was a lady, you can pull these back up over the top. That big flap, I can still do chest compressions through a top. The third and final reason is if you become too tired. If you get to the point that you are physically exhausted and then you can't get up to open the door, to wave the ambulance in, to go to the gate, to flag them in because you live on a lane that they always pass, you know, that they never get your postcode right, you are then not any help to this person. So it takes me back to D for danger. Okay, don't put yourself in on any necessary risk. Okay, if you need to take a moment to catch your breath, okay, we've done a great job, however long we've been at this, there's still that 8 to 9 minutes and you've just put more oxygen in, okay? So if you need to catch your breath, go back to it. But if you've been loud enough to pull everybody in from anywhere, somebody else can tag team and take over for you. Why we do what we do, statistically, and this is then when the figures kind of get you and make you think, in the UK, there are over 100,000 deaths from cardiac arrest a year, which is really bad, 100,000, okay? 30,000 of those happen outside of a hospital setting, 2/3 of those get witnessed, and of those 2/3, there are only sort of 20% of them that receive any help. People are fearful of getting involved. People are worried about being sued, okay, and what it might look like. So what we do with these sessions, I basically alleviate that whole fear factor with what's known as a SARA Act. Okay, so it's a Social Action Responsibility and Heroism Act, just like the Good Samaritan Act that the Americans have. It basically, in legal speak, says that as long as you're doing the best that you can do with the best intentions for this person that you found, if they're in need and you're trying to help them with the knowledge that you've got, the equipment that you've got, and what you can see, you can't be sued as a bystander. You cannot be sued if you start doing first aid on a person and subsequently they don't make it. You can't be sued for cracking ribs. You can't be sued if they have a problem with lack of oxygen, if for some reason they've been down longer than we thought. You can't be sued for that. You can't be sued for exposing a lady's chest in public for the purposes of putting a defibrillator on. Let me get that clear. As a lady, I'm 28% less likely to receive CPR because I've got breasts. People panic, but as a bystander, whatever you offer, okay, with the best will in the world, you are fine, you are covered, okay? And since 2015, nobody's been sued for offering CPR in any form to a person in need.